Good afternoon, everybody. This is Cherie talking to you from Texas again. Today I want to talk a little bit about the benefits of medicinal marijuana, why I've put up a petition to talk to Congress and the Senate and all the representatives and President Obama and Michelle and everybody out there, why I find it so very important that we need to rethink legalization of at least medicinal marijuana. It's a place to start. I was diagnosed in 2012 with multiple myeloma, which is a very painful cancer of the bone and the plasma cells. And since I've been diagnosed, I've undergone multiple chemo treatments, several stem cell transplants. And even though I'm doing much better than I was a couple of years ago, I've started to really feel the side effects of the chemotherapy. And I find myself having to take more medicine to combat the side effects of the chemo. And I wanted to start today by showing you the drugs that I have been put on at one time or another. No way am I saying that I'm taking all these drugs today, because if I did, I wouldn't be sitting here straight. But as a cancer patient, it is very easy to get drugs. And the multiple times I've ended up in the hospital, usually because of severe pain somewhere, I've been given another pain medication. And I believe that although I'm no expert in any way, shape, or form, not even when it comes to cannabis, it's just been research I've been doing in the last couple of months, I've come to see that cannabis could help alleviate a lot of the problems that I have, like nausea, anxiety, depression, which just happens to come along when you're diagnosed with cancer, especially at a young age, and you know you're having to live with it for the rest of your life, as multiple myeloma is still an incurable cancer. And I just wanted to educate myself, and what I found is that I could see myself getting off a lot of the medicines that I am on if I could replace it with medicinal marijuana. I am not an addict of any kind. I easily could be with all the medicines that I'm on. They're very addictive for me, but I force myself to take as little as possible and only as absolutely needed, because I have a little 9-year-old that I'm raising, and when I'm on some of these drugs, I am on the couch. I'm very unproductive, and it doesn't benefit me. It doesn't benefit my family, my daughter. So I would like to show you a couple of the things that I've just been given since diagnosed. When it comes to the pain medication, you start with a fentanyl patch, highly addictive, very strong pain medicine. Currently not taking it. Hydromorphone, another very addictive, strong pain medicine. I'm taking tramadol every now and then for the neuropathy or bone pain that I have. Hydrocodone, a lot of people familiar with that one. Been given that. Hyoscyamine for stomach spasms that I've gotten, maybe chemo related, I don't know. And cyclobenzaprine, another strong muscle relaxant that I had because of the nerves impinging on my spine. And then now I take Gabanton, have to take it every day because of the neuropathy that has developed after 2.5 years on chemo. And like I said, there's no end in sight. These things are probably only going to get worse. And I have to take this every day. Then during my chemo, I get very nauseous, and I call them N1, N2, and N3 for nausea 1, nausea 2, nausea 3. Nausea 2 works the best for me. It's promethazine. It makes me couch-bound, just very out of it, but at least it takes the nausea away. Ondansetron is another one. Doesn't work so well for me, or maybe anymore. And then prochlorperazine, another anti-nausea. A couple of sleep medicines they put me on because of anxiety. I was having trouble sleeping, and because of the pain laying down. Zolpidem and temazepam. I'm not taking either one. Just hated taking sleep medicine, but did what I had to do at the time. What I do take every night is clonazepam. It's an anti-anxiety, and it makes it capable for me to fall asleep. So I take that, and then an antidepressant because I am in my 40s. I have cancer. I'm trying to raise a child, and I don't know when the cancer is going to get worse, and if I'm going to live a long life, and that would make anybody depressed, I would think. A couple of other things for dizziness: meclizine, 25 milligram. I guess that was for dizziness because I threw up all over my oncologist one day. And pantoprazole sodium, which is a acid reflux, because when you take a lot of medicine, you're just kind of destroyed, your stomach juices. So I think that's it. Oh yeah, and then of course my chemo drugs, Revlimid, which is causing neuropathy, and as a side effect has secondary cancer and stroke. So I have to take a baby aspirin every day. And then one of our favorites, dexamethasone. Thank God my oncologist took me off of it. Some people get very angry. A lot of people gain a lot of weight. I lost weight somehow on this. I lost weight throughout my cancer journey. And it made me very, very depressed, suicidally depressed. And so thank God I've been taken off this. But basically, cancer patients get a lot of medicine, and as we all know, the ones for pain, they're very addictive, dangerous to operate vehicles, just not a smart thing to do. And I don't want to be on any of these things anymore. When I did my research, I saw that cannabis, medicinally taken, so not the stuff you just buy off the street and smoke as a joint, which is not good for the lungs either, could help me with my pain, could help me with appetite, something I haven't had in 2.5 years. I explained it to people that I have been in my first trimester. For women out there know what that's like, nausea. For 2.5 years now, I just don't like to eat. I don't like to cook. I don't like to shop for it. My taste buds have been destroyed, and it's just not something in life that I get to enjoy anymore. And then what I understand, marijuana gives you the munchies. It helps with nausea, so that would be 2 in 1. I would love to gain a few pounds because I would say I'm about 1 flu away from becoming very, very thin, very unhealthy. I know this country has an obesity problem, but being too thin brings problems with it as well. So that's one of my issues. I believe what was done in the 80s, I believe by Nancy Reagan, war on drugs, was wonderful. I don't promote taking drugs of any kind, whether it's overeating to fill a void, whether it's over drinking, smoking cigarettes, any kind of drugs. I'm against it. You know, we should try and find other ways. I have a 24-year-old and a 9-year-old, and I tell them to not take that stuff. It's not necessary. I don't believe marijuana is a gateway drug in any way. I am not against it in any way for consenting and educated adults. I have friends who have been doing this, just like some people like a glass of wine in the evening. Some people smoke a joint in the evening. They're productive members of society. They have jobs. They pay taxes. They show up on time. They're teachers, engineers, all kinds of people. And just like alcohol, I don't think there's anything wrong with it. It's just not something for me. I just want medicinal cannabis, marijuana, to be legalized, not just in the state of Texas or Colorado or wherever it is, but federally on a nationwide level, so that people that are stricken with bad illnesses, terminal illnesses, have a choice, the freedom, which is what this country is all about, the freedom to choose together with their physician if medicinal marijuana might be something that could help them. I looked up a couple of things in preparation of this. There are two main ingredients in cannabis. THC, which seems to help for the pain more, and CBD, which does not have any psychoactive effects, and actually seems to reduce anxiety and inflammation. It's actually great antioxidants, which could help against certain cancers, rheumatoid arthritis, multiple sclerosis, Crohn's disease, brain and nerve damage as a result of stroke and alcoholism, and the list went on and on. Epilepsy, I think, is one of them, arthritis. Why should we not have the right and the opportunity to try this? Why should the FDA not get more involved with this and test it so that it's done in a way that is responsible, so that a doctor actually writes you a prescription that you take to the pharmacist, and so you can take this stuff, which seems to have much less of an effect on the liver and kidneys, less side effects, less toxicity, so that I can stop taking all of these, most of these. I want this word to get out there. I want people to react to this. I want people to call their senators, Congress. I've been doing that. This is a good cause. People should not feel bad about being wishy-washy or changing their minds on this. Most of my friends are very conservative, and they see completely eye to eye with me on this, because they are educated, have educated themselves, or have allowed me to educate them, that this is not a drug that is just for the poor, lazy people that therefore are no longer productive and are a nuisance to society. It's for people like me, people like you, people that are looking for something that may help them find relief from pain, anxiety, sleep, arthritis, and a whole slew of other problems. Thank you so much for taking the time to listen to me today. I will be on here more often talking about other things that I hold dear as a mother and cancer patient, and now activist, I guess. Thank you, and have a wonderful and great day.